Hi, I'm Dr. Nesrin Erçelen from Istanbul, Turkey. Today I would like to discuss with you about an emerging therapy option for COVID-19 disease. I've been working as a medical geneticist since 30 years and I've been working in the field as a clinical researcher for regenerative medicine, reproductive medicine, and I have just established and directed labs for genetics and labs for regenerative medicine, stem cell labs. Actually, I worked in the academic field and also worked in the institutes and private institutions to establish a new medical field we call today genomic medicine. So, as we all remember, March 11th, 2020, we came across with a very serious problem, health problem, COVID-19 disease. We know World Health Organization declared it's a pandemic for all the world and tried to respond in all healthcare system, including the prevention, hygiene rules, and also bans to the society and some social activities. Actually, they were trying with NIH and all the world health institutes to find out a reliable, evidence-based and effective treatment and prevention for the disease. Unfortunately, we couldn't have reached such an aim, although there are some kind of promising evidence treatments or some kind of prevention techniques, but none of them could reach the aim finally, recently. What were the basic aim to fight with COVID-19? Actually, we were dealing with the unregulated immune response ended up with cytokine storm in this disease, fatal disease. We were trying to establish some medicine targeting the receptors of the viral infection. Also, we were trying to treat the complications of this inflammation by some drug treatments, monoclonal antibodies, also new plasma therapy techniques, and we tried to use the intensive care unit for mechanical ventilation. Also some high-tech technology with nanotechnology. We tried to establish some inorganic nanoparticles or organic new therapies, nanovehicles, and also we try to fight with the complications, which we are now seeing more often after COVID-19 pandemic. Unfortunately, none of them, as we have said recently, have an effective treatment for COVID-19 disease and the complications. So all the world, all the health system try to establish a new potential treatment, including a biotechnology tool and new kind of cell therapies. This is what we call after 2000, as a result of Human Genome Project, including all whole genome sequencing for a person, and also preparing some cellular products from the biological system. So we thought about preventing this disease, treating this disease, if we could establish new kind of therapies. And these new kind of therapies should include our basic knowledge since we were working on year 2000. We have just came across with the very high potential cell systems, which we are simply called stem cells, and from that we have just derived mesenchymal stem cells, or nowadays we call them medicinal signaling cells. And after this experience, like 20 years in medicine in IVF, when we come across with COVID-19, we try to modify this treatment and use the cells to have an immune regulation for COVID-19 treatment. Actually, what were these cells are doing, as we experienced in the last 20 years, these medicinal signaling cells, if we just give them systemically, they can just come up to the inflammatory area, which is in COVID-19 the lungs, and they come to meet with the inflammation and cytokine storm. And briefly, they can do such a fight, a systemic fight, which the virus already exists by itself. Because this inflammation, this infection is doing a systemic effect on the body, just unregulating the immune system directly and direct the immune cells towards to the body's own cells. We call this cytokine storm. So we have just experienced since 2000, these mesenchymal stem cells have the capacity to regulate the immune system, to decrease the inflammation, to start the anti-scar tissue and give a chance for an original healing. And also, these cells have an antimicrobial effect. Recently, we had just scientific evidence for the systemic effect of the mesenchymal stem cells. And when we come to across COVID-19, the first trials has just aimed to use this profile of mesenchymal stem cells to treat the complications of COVID-19 virus infection. And as the first studies, we had also done a proof of concept study with 8 patients and 3 control patients who had the severe COVID-19 disease. And when we treat these patients, we had seen an immediate immune regulation, immediate anti-inflammation effect of the systemic disease. Also, after the first results in the world and our study, the government, with the government organization and confirmation, we started to treat the COVID-19 patients at the cytokine storm level and also during in the intensive care unit. And we had managed to follow 210 patients from all patients we had been treating. And we declared these observations in our paper. Recently, we have just published in the scientific articles. Ended up this year, the scientists gathered this information all through the world with the COVID-19 researchers and give us some meta-analysis results. In one of the meta-analyses, they had gathered 1,265 studies for treating COVID-19 with mesenchymal stem cells, and just accepted 10 studies, which includes the criteria for the control studies and follow-ups and scientific publication showing the mesenchymal stem cell effect on the disease. One of these centers in the world, in these 10 centers, is our center, whom we have declared the results just the same as the other centers who just made the studies. And also another meta-analysis followed this study and coming from a Mayo Clinic, and they had gathered more than 700 patients who has fulfilled the criteria for the mesenchymal stem cell treatment and follow-up before and after the treatment, like the oxygen levels and respond to the treatment with the monitorized patients. And the conclusion from the 700 patients, 214 patients was our patients, and we have declared the same results, and mentioning especially the use of mesenchymal stem cells in the early phases of disease, just like in the cytokine storm. So actually, one dose of treatment in that stage could help the patients, 70% of the patients, to heal and get a better condition and benefit from the treatment. So, following this treatments and meta-analysis, we have come out that mesenchymal stem cells are emerging therapy option for COVID-19 disease, not only to treat the disease, but maybe give us an option to treat the complications of the disease. Like here, we have tried the treatment on the stroke complication of the disease, who had COVID-19 disease in the intensive care unit, and unfortunately, when the patient wakes up with a stroke complication. And for this group of patients, as a proof of concept study, we had treated a couple of patients and already publishing them in the scientific articles, which show the benefit of the mesenchymal stem cells in the acute phase to use for these stroke complications. And we have some patient experience. I'm sharing them with you, and hopefully these results will help us to discuss the benefits of this treatment in early stroke patients or the benefits in this disease complication. Actually, what these cells are doing, as we had just discussed, they are regulatory immune system treatment cells or new kind of medicine. They have a homing effect on the inflammatory area. They have a revascularization character, bringing the supplements to the inflammatory area, and also they have the capability to decrease the inflammation on the wounded area or inflammatory area and prevent the fibrosis of the inflammatory area. So these characteristics, which we had some proved the pathway, can be used in the other inflammatory steps of the diseases, which we could not have the treatment options yet. So we have just planning to use mesenchymal stem cells who has this characteristics of immune regulation, neovascularization, antifibrotic effect. In the other kind of diseases, we have recently no treatment. One of the candidates is premature ovarian failure patients, which we have planned to do an in vivo maturation for these patients. And also in this patients, we have some kind of good promising results in the preclinical stage. So this may be a new opportunity for the new treatments, cellular treatments. Also, we are just planning to use these cells in the complication of other systemic diseases like diabetes and other inflammatory or autoimmune diseases. Of course, if we look at the scientific revolution in biotechnology. When we combine it in medicine, which we call bench to bedside treatments, it is not enough to talk only about the cellular technology and cellular treatments. But what we need also is the genetic engineering, gene therapy systems, which we are also trying to get experience, and also recently whole the world has good experience and evidence-based data about these new treatments. So when we combine these technologies for biotechnology and include it in the new medicine treatment options, we are hopeful if we can get the benefit of new kind of 21st century medicine, which we call genomic medicine. Actually, what we call genomic medicine is a combination of a personalized medicine perspective, which we have the chance to use the regenerative cells in the regenerative medicine field. But the best option should be prevention, of course. Prevention of the result of a risk assessment for a person, and combining the gene therapy methods with cellular technology, and try to make the benefit of the patients before the disease happens. And if we can do this, to use these treatments before the pathology, we have the chance for a longer, healthy life. And 21st century doesn't only promise this, but we have just seen that it may be an option to a fatal new disease like COVID-19 disease. And if we can use it not only in the treatment, maybe we can just discuss about the prevention of the disease. So this is the question mark now. We are planning to work and try to arrange new studies to see if these cellular treatments may have an option to prevent the COVID-19 disease-like syndromes. Of course, vaccines are a huge kind of new promising agents which we use to prevent the disease, but considering the long-term prevention, cellular therapies may be another option to support the immune system and prevent new diseases like COVID-19 infections. Of course, all of these biotechnology and gene technologies added with the telemedicine, we can consider to humanity another option which we can use in the other fields of the technology and achievements of the humankind. So, as a result, cellular therapies and biotechnology has the life-changing idea in medicine today. And with these changes, we try to gather our clinic and give a new kind of health system for genomic medicine. Here you can see genomic medicine clinics have the characteristics to work as a multi-departmental characteristics, which we just include different kind of departments, neurology, infectious disease, other clinical departments, and also genetics, regenerative medicine altogether, to put the benefit to the patient and personalize for the personalized treatment. And also, these studies or these clinics may have the chance to establish a more comprehensive multi-departmental studies and work, clinical work, also multicentric work, which we can combine all the world health systems with the help of telemedicine or computerized based technologies. Here I want to thank all our colleagues, students, and also my private team who is my daughter, who has just started for bioinformatics in NYU, and also my younger one for the digital work, which I tried to sum up this presentation to you. Thank you very much, and hope the healthy days for all humankind. Thank you.